My name is Filippo Dall'Olio. I work in the University of Bologna in Italy. I'm a PhD student, and I wish to thank the organizer for having invited me to present my study. My study is about PD-L1 in circulating tumor cells as a prognostic biomarker in advanced non-small cell lung cancer treated with immune checkpoint inhibitors. Briefly, CTCs are a promising source of biological information in cancers. They are also related to tumor burden, and there is an increasing number of evidences about its role on immune response against cancer. For now, PD-L1 is the only validated biomarker for immune checkpoint inhibitors in lung cancer. And data on the role of PD-L1 expression in CTC are still lacking. So this is a prospective single-center cohort study. We enrolled advanced non-small cell lung cancer patients. We received second or third line anti-PD-1 or PD-L1 monotherapy. Blood samples were obtained within 14 days before treatment start. CTCs were identified and counted with cell search system, and PD-L1 assessment on CTCs was performed with the PE-conjugated anti-human PD-L1 antibody clone MIH3. We divided patients in 3 categories: no CTC, so CTC null, at least 1 CTC, and at least 1 CTC PD-L1 positive, and they are CTC pos, and at least 1 CTC and no CTC PD-L1 positive, CTC neg. The primary objective of our study was to evaluate the correlation between CTC abundance and PD-L1 expression on CTC with overall survival, while the secondary objective were to explore the correlation between PD-L1 expression on CTC and PD-L1 expression on matched tumor tissue, the correlation of CTC count and PD-L1 expression on CTC with PFS, progression-free survival, response rate, and durable clinical benefit, and the correlation of CTC number with tumor size. We enrolled 39 patients. CTC were detected in 24 of them, ranging from 1 to 59 cells per blood sample. Of them, 15 has no cells, 13 has CTC positive, PD-L1 positive, and 11 CTC PD-L1 negative. The 3 categories were very similar for all the clinical pathological characteristics, apart for gender, that with the CTC positive were more common in female patients, but the low sample size did not allow us to draw any conclusion on that. We find that there is no correlation. We found no correlation between PD-L1 positivity on tissue and on CTCs, and even no difference in terms of PD-L1 productivity TPS on tissue between those with CTC PD-L1 positive and those with CTC PD-L1 negative. Anyway, none of the patients with no PD-L1 expression on CTC has a PD-L1 more than 50%. We found instead a correlation between CTC number and baseline tumor size, as expressed by the sum of diameter according to RECIST criteria. And in terms of overall survival, after a follow-up of 12 months median, we found that the CTC negative, so patient with no PD-L1 expression on CTC, has 2.2 months of median overall survival versus 3.7 months for those with PD-L1 positive CTC and 16 months for patients with no CTC detectable. We can see the curves, and we can see that there is the possibility of long-term survivorship. That is one of the reasons for the use of immunotherapy in lung cancer. There is none of the patients with PD-L1 negative circulating tumor cells had an overall survival more than 5 months. And instead, we found a little, if no difference between those with no CTC and those with PD-L1 positive circulating tumor cells. We validated it with a multivariate analysis that included all other well-recognized prognostic factors, and found out that our CTC score is still significant when accounted for other prognostic factors. Similar results we obtained with progression-free survival. No difference between those without CTCs and those with PD-L1 positive CTCs, and a bad outcome for those with PD-L1 negative circulating tumor cells. And the prognostic value was confirmed also analyzing response rate and durable clinical benefit. So in conclusion, our paper confirmed the prognostic validity of CTCs detection in blood sample and its relation with tumor size. It also suggests that PD-L1 assessment on CTC could add a significant prognostic value for non-small cell lung cancer patients receiving immune checkpoint inhibitor therapy. We found no correlation between PD-L1 expression on tissue and on CTCs. And as a future ideas of development, future analysis on larger set of data is warranted to investigate the predictive value of our score, meaning we should enroll patients treated with other agents to better understand the predictive value of this score, and potentially patients treated with combination treatment like chemo IO for lung cancer, that is an option now even for patients with high PD-L1 expression. Anyway, assessment in first-line treatment is ongoing. Thank you very much for your attention.